So I have trans kids, and families like ours have taken a lot of L's lately. But there was finally some good news this week. The backstory is this. The medical super team of Dr. Oz and RFK Jr. really did a number on our kids' health care a couple weeks ago. First, they issued a declaration of findings that said that gender-affirming care for kids was literally not medical care for federal purposes. Now, it is medical care. It is recommended by every major medical association in the United States. This was totally unprecedented, the idea that the head of the HHS could just announce what isn't medical care, especially when the head of the HHS's previous medical experience was primarily hard drug use. And it was the first step of basically an extortion campaign. They then issued a rule that any institution that provided minors with gender-affirming care couldn't accept federal health insurance, Medicare and Medicaid. Not that they couldn't accept them to pay for gender-affirming care, but that they couldn't accept them to pay for anything, not x-rays or flu shots or pediatric cancer treatments. Now, there isn't a hospital in the country which can run without patients who are on public health care. The hospitals would all just have to close. So basically, the Fed's plan was to grab the plug on some old lady's respirator and say, stop treating trans kids or grandma gets it. Or actually to grab the plug on the entire hospital and say, stop treating trans kids or nobody sees their doctor. And the threat started right away. At least 3 hospitals got letters. But I told you, this is good news. 22 states, advocates, patients sued right away. The suit wasn't a surprise, but I'm sure that HHS's thinking was, we'll threaten, we'll create confusion, get the hospitals to close their clinics so they don't have to close down in general, then even if we lose the lawsuit, we've basically burned down the village. But then this past week, there was a stay. On March 19th, there will be a hearing about whether Robert Kennedy has the legal authority to just announce what medicine is, then threaten to run any hospital he doesn't like out of business. That ruling will take 30 days. So at least until April 19th, there is a reprieve. And the hope is that the whole lawsuit can play out before they pull the plug on Granny. That is a big win. Now, in the meantime, if you want to help protect trans kids, you can comment on the new rules until mid-February. Go to bit.ly/transcomment. Tell the government what care for trans kids means to you and your family.